taking time out of your day. I know these Zoom calls can get exhausting, but after attending last week's session, we realized this one is probably even more essential because there were a lot of questions that came from the session, especially around the preparedness plan. At that time, there was also the grant happening. So understanding that you did need your preparedness plan just to even apply for the grant. So we realized, since you all are very key people that connect to all of these business owners, and especially being an immigrant myself and having been in some of these immigrant businesses, we also understand they might need to hear it 3 or 4 times, right? To make sure they understand the impact of these regulations, that they may be subject to fines if they're not being responsible for their employees as well as their customers. I think they think a lot about the customers, but they don't really sometimes think about it also impacts the employees and their business and themselves. So we're glad you're here with us today. Some house cleaning. Kenzie and I will be monitoring the chat box. If you have any questions, please feel free to put it there. We'll make sure. Anthony will be sharing links and information on the chat box. We will try as best as we can to copy them, but after last week, we learned sometimes we end up missing some. So make sure you monitor that check box for any links that you may want. What we will do after, we will share with you the recording. We are recording the session, and we will share any other links or slides that Anthony forward to us after the meeting. Anthony will be introducing himself and presenting. At the end, we'll have a lot of time for questions and answer. Any questions for me before I transition? All right, you all are awesome. I just asked you to stay on mute unless you have a question. You could type it on the chat box or raise your hand and we'll proceed. But now we will pass it over to our friends at MIOSHA, Anthony, who has graciously decided to join us today and provide you with. I attended a meeting with Anthony and I know the information. He's very thorough, and that's why I was like, you have to do the session for us. So take it away, Anthony.
Thank you, Gracie. Good morning, everybody. My name is Anthony Smikla, but my friends call me Tony. I encourage you all to call me that. You may or may not notice my video is already frozen on the Zoom meeting, so I'm going to turn that off. The technology I have is not the best, but you know, I don't want you to take that as I'm hiding from anybody. I'm very much involved in here. Just to let you know, I'm an industrial hygienist at MIOSHA in the Consultation, Education, and Training Division. That means that I am completely separate from enforcement. I make no referrals to enforcement. Everything that I deal with is confidential. And basically, I'm a free resource to employers and employees in Southeastern Michigan. I cover everything from downriver to Ann Arbor up to Oakland. So I got, you know, basically the inner ring suburbs out to Ann Arbor. The COVID crisis has resulted in significant new rules imposed on employers that have come from outside of MIOSHA. So we're going to be talking today about executive orders that were issued directly from the governor's office that MIOSHA is assisting in interpreting and consulting businesses on. The reason that I kind of take a minute to address that is I always kind of want to make the disclaimer, I'm not involved in writing these things. I just do my best to get answers for people as to what they have to do with them. As a initial note as well, on Monday, 2 new executive orders came out that impact the topic of this presentation. Those are Executive Order 168 and Executive Order 169. 168 deals with food selling establishments, so think grocery stores basically. And 169 deals with long-term care, so think, you know, assisted living, retirement homes, basically. So my materials have not been updated to reflect any information that may be in those 2 new executive orders. I apologize. But overall, the walkthrough that I'm going to give you today is adaptive. I'm just going to give you the broad strokes approach on how to work through advising a business on reopening based on the new requirements of the executive orders. So I'm going to start out by kind of showing you a checklist that I pasted into the chat, running through it. We'll open up the State of Michigan MIOSHA resource website, and I'll show you where things are located on there so that you can find them when you're looking for them again. I have a slideshow, a PowerPoint that runs through the general requirements of 161, and I can show you where separate slideshows are for specified industries. We'll then take a look at the template, the Word template, COVID response plan that includes the risk assessment that you have to do for employees. That's what Gracie was referring to earlier that you need for the grant, and is really the major requirement of 161. Then I want to just let you guys in on a little news regarding MIOSHA enforcement of this topic. And then hopefully at the back end, we'll be able to open it up for some questions and answers. Just as a heads up, I will not be able to monitor the chat terribly closely. So if my audio breaks out or anything, please, let me know, notify me, and I'll double back and I'll make sure that, I'm being clear for everybody. So I'm going to start sharing some information. The first thing that I'm going to share out is going to be what I attached in the chat. So if everyone wants to take a look at the chat box in the meeting, there should be a PDF called Workplace Guidelines that is included in that chat. Just double click that to download it, and you're going to want to save that. I'm going to open it up from our website. So it should be the same document that you're all looking at.
Could you actually repaste that? I think people that join after after you paste it cannot see it.
Absolutely.
Thank you.
Maybe. Absolutely. More chat. File. Okay, that should have just been reshared in the chat again.
Yep, it's there. Thank you.
Okay, and that should appear as what appears on my screen online. And this is really a great tracking method for any employer who's looking at making sure they're doing the right thing right now. Literally top to bottom, check off the boxes as you go through it. So the first thing that they should do is either review the executive orders, which are legalese and not the easiest to understand, or review our translated MIOSHA COVID-19 workplace safety guidelines for employers. So that is a hyperlink. You can click on that, and that will open up the slideshow that I'm going to be running through with you today. You guys see where that's located? So that is very useful information for you to refresh yourself if you need to advise anybody. That is hyperlinked in there, so you can use this also as a online or a electronic tool for a library resource. So that's your general requirements. And when we get to the standard, you'll understand how these all work together. For a specified industry that has additional requirements, right, they have to do more than the average company. Each of these beneath opens up the separate PowerPoint for that industry. So if, for example, you're aware that a lot of your served industries are restaurants or construction, you could, easily provide them with that PowerPoint for their own review and education. or conduct a training off these PowerPoints on your own. These are available for you to use, and that's why we call this a train the trainer session. These are training materials that you can use for your served industries. So we'll go through those later on in the presentation. So you'll hear me present the slides one time. We're recording this presentation, so you could review this and my explanation of these slides in order to go out and explain them maybe in another language to another person. So that's step number one, is knowing what the rules are. One rule that's common for every employer is that they must do an exposure determination for their employees, right? We'll talk about that when we look at the written program, but they're going to say my employees are low exposure risk, medium exposure risk, or high exposure risk based upon what they do. And it may be that a given facility has some employees that are low exposure risk and some that are medium risk. It's kind of based on the duties of the employee and the job that they do. So you may have one classification for your receptionist and another one for your nurse, or whatever it might be. The third thing that they have to do is develop a COVID-19 preparedness and response plan. That is a written document that's just like a written safety program they would normally have at their office. Everything that's in orange here, once again, I'll control click, is a hyperlink. This one, which I don't think we'll share on the screen right away, opens up the template plan for COVID-19. And I can, of course, paste that in the chat as well, just to make it easy on everybody right now. So let me do that.
Anthony, can you repeat? You cut off a little bit there.
Thank you. Repeat from where, Gracie? Do you know?
Just when you said click on COVID-19 preparedness and response.
Sure. Click on that hyperlink on the checklist, and it opens the document that I will be pasting in the chat momentarily, which is called the OSHA 5700.
I got something. Hi, Ani.
Preparedness and response. Yes.
So last year when they were doing the blight blitz down the corridors and they were giving out misdemeanors for commercial buildings, I don't know if you remember, we had a Motor City Match Design awardee that got her misdemeanor or her ticket dismissed. We were working with Dante. She got the exact same tickets again, like this last month. I sent you an email. I'm wondering, since Motor City Match is kind of on hold, if that exemption can extend. Do you want me to re-forward you the email? Yeah.
I'm sorry, I'm having a little bit of a hard time with my screen right now. I was trying to figure out who was talking. who was that? I apologize.
Okay, thank you.
Can you repeat? We don't know who was speaking, so he's like, can you repeat your name and the question? Was that you, Crystal? Hello?
Let me. Yeah, if whoever that is identifies themselves, I can check my email for him.
Crystal, was that you? Whoever asked the question, we didn't know who was speaking. If you could please write it on the chat box so we can make sure Anthony gets it, or re-forward him the email. Thank you. Go ahead, Anthony.
Okay, thank you. So let me just reshare that checklist real quick. And Gracie, what are you seeing on your screen right now for my screen? What am I sharing?
You had the checklist and now we see Zoom.
Okay, I don't want that. I want the checklist back. Hold on one sec.
I think it's your it's workplace guidelines reopening. It's in your menu bar, the one before the Zoom.
Thank you. Yeah, we got it. Okay. So that COVID and preparedness response plan is located right there on the hyperlink. And I will ensure that a copy of that is posted to the chat. That's what I was working on. And I will throw a copy of that in the chat right now. And I apologize. I've been using a lot more Microsoft Teams and Zoom. I'm not quite as nimble at Zoom as I should be.
Well, you don't worry about it, and I'll try to pull it up and put it up for them.
Oh, thank you, Gracie. I appreciate that. I'll just keep clicking along then.
Okay.
Okay. So continuing down the checklist here, the COVID-19 Preparedness and Response Plan has various sections. All industries have to do some of the steps that are listed beneath here. So you need to look at your policies and protocols. That's your human resources approach. You know, what do you do if somebody has symptoms? Who do they report them to? You know, whose job is it to report it to the local health department? That kind of policy and procedure work. You need to develop a daily entry self-screening protocol. You know, a questionnaire, a temperature check, a symptoms check. Once again, typically specified by county. You need to designate a worksite supervisor. So there needs to be a person on each shift at the workplace who is responsible to administer this preparedness and response plan. You need to install physical barriers where possible between customers or employees. Demarcation lines where possible to maintain social distancing. And you must provide employee training on the new procedures and protocols. This link beneath there is a good start on that employee training. You can use that for your employee training. If you click that hyperlink and you review your preparedness and response plan with your employees, there's a good chance you've completed your training obligations. You know, you just have to be I'm sorry, did someone have a question?
No, I think someone sneezed.
Okay. The last bullet point on here does not need to be performed by an employer, but I recommend that it is. That's taking a look at what MIOSHA enforcement is going to be doing. So this last bullet point, the COVID-19 Interim Enforcement Plan, is the instructions that are given to the MIOSHA enforcement officers who are going out and doing the inspections. If you want to know what they're going to be asking for, who they're going to be interviewing, and what the consequences are going to be if they don't like what they hear, that information is public knowledge, and it's down there at the bottom of this as well. Beneath the checklist, you'll see that we have our michigan.gov/MIOSHA. If you click on that hyperlink, I'll show you what, hopefully I'll be able to do this real quick and easy. I'll just open up a new tab and hopefully this will jump. This will open up our website, okay? All of MIOSHA's public-facing information is located here. I could give you a tour of the whole website some other time. It's very convoluted, but this training is easy. It's this giant button right here. It says MIOSHA COVID-19 Response Resources and Guidelines. You click that button, and everything that we have on COVID pulls up. This is another place you can get the reopening checklist I'm going through, the preparedness and response plan for low and medium risk employees, our various industry updates you can see above it. Then down beneath here, you can see various fact sheets on how to fit a mask, the difference between a mask and a respirator, who's required to wear a respirator. You can see information from the governor's office on the Safe Start restrictions, the state of Michigan resources. Back to Work Safely, AIHA, is an amazing resource from people in my profession that gives best practices for even more industries than we have. Like, for example, I don't think we have educational. Yeah, we don't have educational facilities. We have pre-K-12 schools. Okay, we do. But AIHA has a few more industries than we have on our website. So if you don't see an industry on ours, go to this Back to Work Safely AIHA, and they may have more for you. CDC Resources, that's the science of COVID. You know, how infectious is it? How long does it last on the surface? What's good filtration for it? We have downloadable posters. We have social media graphics. We have Safe Start information that's updated regularly on how different companies are doing. Down here is a great link. I've had a lot of questions on this. Where can I find personal protective equipment? There is this Get Started button, links you up with Pure Michigan Business Connect, which is a bunch of manufacturers who have PPE resources available and who are working with the state of Michigan to get those to where they're needed. So if you can't get hand sanitizer or face masks or whatever you need, you would go here to start looking for those. What about people who need accommodation or refuse to work? This button right here addresses that kind of HR tricky situation, unemployment insurance, who gets benefits, that kind of stuff. And then down here at the bottom is your fallback hotline number. Area code 855-SAFE-C19. Pretty easy to remember. If you call that hotline, you tell them you have a question about workplace safety and you're in Detroit, there's a good chance they're going to forward you to me and I'm going to end up talking to you. But it's people like me on the other end of the phone who are, I guess, considered experts in COVID. I don't consider myself an expert in COVID, just to be clear on that, but I think other people do. If you have an actual concern, if you want to file more or less a complaint regarding COVID preparedness, someone's not doing what they have to, that's this button right here. Down at the bottom, we have links to the governor's Safe Start program explaining how different regions will be reopening. We have a Safe Start map that lets you know how people are doing in real time. And then on the right here, we have the My Symptoms app. This is a no-cost web application developed by U of M School of Public Health and LEO, the state of Michigan, to allow employees to remotely do their daily health screening. In other words, it's a phone app that lets people report that they're not feeling sick before they go out for work for the day. Okay, so that streamlines one of the requirements employers have to do underneath the executive order. So this one page, and then down here at the bottom, you should all do this, receive updates. When things change, that's how you get, the new information for the new executive orders. So this one page right here should have everything you need on it. You may need to follow a couple links off it, but this should be everything that you need. And it's such an important page that I think this one I am going to just post in the chat directly. Yeah. Okay, there we go. All right. So that's the main thing. If you guys are going to be going and doing outreach to employers on what they need to do to reopen, this should be your starting point. That this web page right here should really be where you start, where you direct people to. You should take a few minutes, tool around it on your own time, get used to it, know where these resources lead and what they have in them, so you can direct people to where they need to go. If you have questions, once you start using this as a tool, feel free to reach out to me. I will be happy to be a resource to you. I think my contact information should be somewhere. Gracie, does everyone have at least my email address?
Yes, it was on the confirmation email I sent this morning.
Great, thank you much. So that was where I wanted to start today. So the checklist kind of is a tool for the employers to use to make sure that they're getting everything done that they have to. But to complete that checklist, they would use the resources that are available on this webpage, right? They should be able to complete their response plan, their risk assessment, get the resources they need to get their workplace ready, all that through this one location. So that being said, I'm going to open from this webpage a PowerPoint and run you guys through it, because this is probably what you're going to end up doing with various businesses. Get that up. Where's that opening at? You have the sinking feeling this is getting downloaded. All right, we're going to open it up for my PowerPoint instead of from that button. You know what, guys? I'm a little concerned about this. Let me make sure this works, because if it isn't, I got to get somebody on it.
Kenzie, are you seeing this? Can you log? If Anthony's unable to share, are you able to share?
Yes, I am.
Okay, guys, I'm sorry. I'm going to open up that presentation from my shared drive. Hold on one sec. I'll get her open. Ooh, you guys don't need to be seeing that.
While Anthony's pulling his presentation, if anybody has any questions so far, please feel free to type it in or ask it out loud while he's pulling it up.
Okay.
I have a question, Anthony. I know you showed us a lot of the links. Is there any of them that are translated?
Oh, no, I don't believe that we have those links translated. We have our response plan, the Word document template translated to a number of languages, but I don't believe that we have, oh, and the signs. The workplace signs have been translated to a number of languages.
Okay.
So, limited. The signs in the plan have, but most of the supporting information has not, to my knowledge.
Okay.
I think that your best resource for that is going to be Karen Filippi at the Office of Global Michigan. I know that she was working on getting translation performed as of a month ago, but I haven't gotten any updates as to where they're at with that.
Okay.
Okay. So the current, actually, I'm going to take a sideline before I jump into this. The executive orders can be found on a number of places online. So let me reshare. There's one place where they are correct. I'm going to put that web address into the chat as well right now. So I'm going to share that address now on my screen. These are the effective COVID-19 executive orders. The reason that this is the website that you want to use is because this one is updated. The other Michigan.gov executive orders page is not updated, and it still has the rescinded or no longer effective executive orders listed on it. So you would have to do some legal research to figure out what's still in effect and what's not if you use the other page that has this information. So the reason I like this one is when something is rescinded, it's taken off, and when something is enacted, it's put on. So this is the one that's effective as of today, and you'll see 168 and 169 that I was talking about are on this. The main executive order putting requirements on businesses is Executive Order 2020-161. So off that website, you just click on Executive Order 2020.161, and you'll be able to see the exact language of it. I'm not going to read you the regulation, but I'm going to give you a quick scan of it. All this language in the top is legalese and has no actual information that your constituents really need to know in it. They need to know the information that starts right here after number 1. And this is what our PowerPoints cover. Section 1 goes through A down to U. So all this right here is section 1, right? All this stuff in blue now. That applies to every employer in Michigan. Every employer in Michigan needs to do what's required in section 1A to U. Then some businesses have higher requirements. So going down past 1, we'll go down to where it says 2 now. Not this little 2, that's just poor documenting. Past U, number 2, you'll see businesses who are primarily traditionally performed outdoors must. So 2 is for landscapers or gardeners or whoever works outside, lifeguards, you know, that kind of thing. Then 3 is for construction industry, right? So each of these separate numbered sections puts additional requirements on specified industries that are deemed for some reason more hazardous. So the more people basically have together in a small amount of space, the employer needs to protect them, processing or casinos or whatever. So there, this one is. Casinos is 15. I think that's the last one. Racetracks. I don't know anything about that. Okay, so 15 casinos, right? So sections 2 to 15 all deal with the specific type of business and put additional requirements on that business. So what we have generated so that people don't need to hunt down the effective regulation, scroll through it, read the legalese, find the part that actually applies to them, is we've translated this executive order into a variety of PowerPoints, and that's what's on our resource page. So just to take a look at one PowerPoint, I'll just do the one for retail, I guess, because that's kind of a standardish one. Let me share this screen.
Can you please repeat the number that got to that part?
Executive order.
Oh, it's right here. Never mind.
Okay.
2020-161, right?
That's correct. 2020-161 is the appropriate section today. You know, it's number 161 because Governor Whitmer has issued 161 separate executive orders this year. Actually 169 by the most recent one. So, you know, things are changing very fast. But yeah, 161 is the one to look at today. Okay, can everyone see my PowerPoint presentation?
Yes.
Great. Okay, so all the various PowerPoints start with the same general slides and then have the industry specific slides at the end. So the first, however many, 15 slides or whatever of this presentation are applicable to all businesses. And then the last 15 slides or whatever are where they break out what's specific for retail. So this is the type of PowerPoint that I would expect you guys to be using to train business owners. Even if you don't pull up the PowerPoint and go through it with them, you know, this is something you could review or have going on your computer to scroll through while you're talking to them. Okay. So the last time this was updated was July 30th, right? So we always have a disclaimer, you know, we only last reviewed this a week ago, you know, maybe it's outdated now. To my knowledge, it's not outdated as of today. Just like our checklist, the first slide runs through what a business must do. So let's talk about the scope of 161. 161 applies to employers who have an employee and who require that employee to leave their home for work, right? So whether they go to your office building or a client site or even a third party site to do work. If you say, you got to go to Starbucks to work, you've required your employee to leave his home for work. So I'm kind of interpreting in-person operations. I think that's a misleading term. As soon as you tell an employee, and this was basically June 4th that the governor said, okay, everybody go back to work. As soon as you say, okay, we're going back to work, within 2 weeks, you were supposed to have this stuff laid out, which was an unreasonable timeline. But you need to have your COVID preparedness and response plan, your designated supervisor, your employee training, your self-screening protocol, and then all these various control methods underneath there, social distancing, hand washing, face coverings, all that stuff. Basically 2 months ago now. So don't worry, everyone's behind the ball, but that was the legal requirement that you have this essentially, mid to late June, in place by mid to late June. The response plan, what an employer is doing to protect their employees from COVID, uses guidance that was put out there by OSHA for the categorization. So when you're looking at what employers are high, medium, or low risk, you're using criteria that federal OSHA specified. I don't think we go into that too much in this presentation, so I'm going to go into it a little bit now. Low risk is essentially only employees who work from home and don't interact with the public. If you have administrative staff working remotely, if you have people who don't really deal with customers, they work from home, maybe they got to come into the office periodically to pick up some paper or supplies or drop something off, but they're not dealing directly with customers. That's a low exposure risk employee. Be very conservative in calling somebody a low exposure risk. Most people should not be low exposure risk. If they're interacting with the public or they're working in a shared space with a lot of other employees, even a couple other employees on a regular basis, they're getting bumped up to medium risk. Medium risk is the giant bulk of employees. Medium risk is employees who interact with the public on a regular basis or work in a shared working space on a frequent basis, but who are not exposed to known or suspected COVID cases as part of their work duties. So most office staff, construction staff, all these people that we're talking about are kind of presumed to be medium exposure risk. That's kind of the category they fall into naturally unless something else is going on. And let's talk about what that something else is. So obviously, if they're taking massive steps to isolate themselves, they drop down to low exposure risk. But what pushes them up to high exposure risk? High exposure risk is an employee who, because of their job duties, is expected to have contact with known or suspected COVID cases. The easy example is an ambulance EMS personnel, an emergency room triage desk person, nurses and intensive care units who deal with, infectious diseases. But there are some other ones that aren't as obvious that I like to point out. Certain wastewater operators who deal with waste may be high exposure risk. First aid responders at a company, if you have designated first aid responders at your facility, if they're expected, if somebody starts choking and coughing and it's somebody's job as a first aid responder to go help that person who's choking and coughing, they may get bumped up to high exposure risk, right? You're asking them to go help somebody that they don't know what's going on with them. So look at your first aid responders when you're talking about high exposure risk. Things like that, right? Just be very aware of it. Very high exposure risk, you should not be dealing with. A very high exposure risk is the doctor who intubates the known COVID patient, right? They're basically going to get sprayed with known COVID active virus. Nobody should have a very high exposure risk. If you think you have one, please call me. I'll talk you through. So based on the risk that you put your employees into, you need to provide them with different levels of protection. Okay, we'll get to that when we get to the exposure plan. Lower risk requires less protection, higher risk requires more protection. So just to finish out the slide here, when you're doing a risk assessment, you want to look at risks in the workplace as well as risk factors at home and within the community. You want to look at the CDC guidance. You want to have some HR policies in place, and you want to make sure that you implement your controls. And I understand that these are the bullet points that most people probably want clarification on. So we'll be really able to dive into those later in this presentation. Once again, you can click that hyperlink at the bottom. It'll pull up that same template form. We're really trying to push this form out as many ways as we can because every employer needs to have it. I mean, that's all there is to it. You know, every employer in Michigan needs to have one of these programs. The template is for low and medium risk. If for some reason one of your employers is a high risk operation, you know, a healthcare facility, you know, an urgent care or something, send them along to me and I'll do some one-on-one work because they got to do a lot of extra stuff that wouldn't be in that template. All right, so everybody needs to designate a workplace supervisor. You might want to designate more than one if you have more than one shift, because you need to have one designated supervisor on site at all times whenever an employee is present. If you only have one employee in a building, they need to be your worksite supervisor, right? The worksite supervisor needs a little bit more training. They need to know the response program more or less like the back of their hand and be able to explain it to the other employees. So I'm training you guys. You're probably going to train the workplace supervisor. Then the workplace supervisor is probably going to train the employees. You know, we're just passing the knowledge down. The daily self-entry screening protocol. Certain industries need to do temperature screening. Meat processing, manufacturing, and casinos that I know of off the top of my head. Most don't need to do temperature screening. But all need to, at a minimum, do a symptoms questionnaire. So all employers need a written program and some method of conducting a questionnaire. That's that My Symptoms app, that phone app that I showed you, that covers this, okay? Otherwise, they could just do like a hard copy or electronic form. That form, you know, there's a lot of issues regarding confidentiality of health, HIPAA and ADA type stuff. So as far as record keeping goes for that self-screening protocol, you know, if you have questions on that, please ask me them. All workplaces must maintain 6-foot social distancing where they're able to through the methods that are listed here. So don't just tell your employees to stay 6 feet apart. As much as you can, show them how to stay 6 feet apart or prevent them from getting closer than 6 feet. If they are within 6 feet of one another, they need to be masked if they cannot maintain that separation. And if they're within 3 feet, they should be masked and wearing a face covering, a face shield. You know, one of those drop-down welder-looking hood type things. All employers should promote remote work to the extent possible. That's the governor's order. Governor says if somebody can work remotely, they should be working remotely right now. Also, according to the governor, only essential business travel. Essential meaning what you have to do to stay in business. Not I'm an essential business, therefore any travel I do is essential travel. Really, you know, don't share office spaces, work remotely as much as you can, and stay home. Don't travel as much as you can. Okay, so keep those two pillars in the back of your mind when you're setting things up. Then the last one's kind of a little nitty-gritty one. Use PPE and hand sanitizer. Just ignore that public transportation. Use it everywhere. Just encourage use of PPE and hand sanitizer, period. But the 161 says on public transportation.
Anthony, this is Gracie. for the 3 that you need the signage, you need the ground, and you need the barrier. Is
And-
that required that you have all 3 for
No.
all businesses, or one or the other?
Yes. Thank you for clarifying that, Gracie. They would be looking for one or the other. Yes. The most common approach is signage. That's the least effective approach. Try to push people to ground markings and physical barriers. Okay? Physical barriers are best. Ground markings are second best. Signs are third best.
And
But
you
yes.
said, but if they're within 3 feet, they have to have the face mask.
No, I didn't. I said if they're within 3 feet, they should have the face mask.
Sorry.
Picking up on that. They are required within 6 foot to wear a face covering face mask. They are recommended if they are within 3 feet to have a face shield. Once again, it's how the governor wrote 161, or whoever she had wrote it. I feel like they missed that. I think it should have said must, and they said, should on accident. But yeah, it says should for the face shield if you read it. Okay.
Thank you.
Cleaning and disinfection protocols. Doesn't mean daily cleaning and disinfection. Certainly high touch areas, thinking doorknobs, shared, cooking facilities, bathrooms, sinks, counters, things that a lot of people touch, should be disinfected and cleaned multiple times per day, but you don't need to do a top to bottom disinfection of your facility daily. Okay. You just need to step up your protocol. So, if you said, every hour we'll go wipe down the front door, the back door, the customer, access counter, the employee bathroom, rattle off what you think your high touch areas are and say, we're going to go hit those every hour and follow, the right disinfection protocol. And then we're going to do a thorough cleaning, as needed or whatever. That's really it. There's no specification on exactly how frequently is frequently. So whatever you're doing, do more. One thing that you're going to want to show is before we were doing A, now we're doing B, and B is more than A, right? It says increase, so you want to show an increase. The response and notification plan for confirmed cases of COVID-19. Employers, this is a huge one, must notify the local public health department immediately. If anyone needs contact information for a local public health department, I can find that for you, but it should be pretty easy to find on your own as well. Just whatever county public health department, Wayne County Public Health Department, Oakland County Public Health Department, just Google it, it should come up right away. And the way things are going in today's day and age, I bet you they got that reporting link right on the front. Okay, once you have a confirmed case, you got to get that person out. You got to close up the areas that they worked in. You got to get them disinfected and cleaned up. You got to inform the local health department. What you don't do is tell all the other employees that Bob is sick with COVID. That's a violation of ADA HIPAA right there, right? You tell the health department tells the other employees after redacting any protected information, right? So it's kind of a pass around of that notification. Yes, if it's a small company, people are going to know who it is. That's just reality. That CDC link on the bottom, if you do have a confirmed case or a suspected case, is also defined in that CDC link as well. It's, 2 or more of these symptoms and one of those symptoms. If they have that, they must isolate, basically quarantine, right? Used to be 14 days. I think we're down to 10 days now under CDC guidance, 10 days of quarantine. All workplaces need to do, there's something in Spanish, that's good. Communication and training on the practices that they're using in the primary languages common in the employee population. Notice that is plural, okay? Languages. It's not what's the most common language. Okay, we got 5 guys who speak English, 4 who speak Spanish. Therefore, we're going to do the training in English. It's basically, if you have like more than 1% or 2% of your work population whose primary language is something, you have an obligation to teach in that language as well. Primary languages implies there's going to be more than one, right? So I would say, as a rule of thumb, if you have more than maybe 2% of your workplace population whose primary language is other than English, you should provide the training in that language to those people. That's just a rule of thumb that I came up with. That's nothing official from anywhere. But if I was looking to stay out of trouble, I think I could argue that, you know, if 1% of my employee population speaks a language that's not a primary language, but if I got 5%, I'm going to have a real hard time saying that's not a primary language. You know, that's starting to get up there in the percentages. Okay, so you need to provide the training in that language and place the posters in those languages. Like I said, Office of Global Michigan has been working at translating the posters, translating the response plan. I do not know the current status of that project, but that is certainly something I can ask about. And I will do that and follow up with Gracie about it. Face coverings. Employers must provide non-medical face coverings to employees, okay? This can be almost anything, all right? They can be disposable, surgical masks, cloth masks. They can even give their employees respirators, but if they do, they have to comply with the respiratory protection standard. So the employer pays and they provide an adequate amount to the employees, meaning it is not good enough to give one surgical mask to your employees and tell them, this is your mask, reuse it. You got to give them enough that they can keep and test on for their work shifts. So if it's a washable mask, they're going to need at least 2, and they're going to need to alternate them and wash in between. If it's a disposable mask, you need to give them at least 1 mask per shift that they can wear throughout their shift. So yeah, you got to source PPE, which is why I wanted to make sure you all had that resource on our website. So when do you need to wear the face coverings? This gets really tricky. The reason it gets really tricky is because we have 2 executive orders that conflict regarding face masks. 161 says one thing, and then I don't know what number it is now, but it used to be 153. 153 said another thing. So I'm going to take some time and go through this in detail. And I know it seems a little academic, but you're likely to get questions on it because I get questions on it all the time. Okay, so taking a look at this slide first. Like I said, 161 applies to employers and employees. Employees working in the workplace must wear a face mask when they can't maintain a distance of 6 foot from somebody, or when they're in a shared space, including meetings, restrooms, and hallways, right? So even if they're more than 6 foot away in a hallway or restroom or an in-person meeting from everybody else, they also need to wear a face covering in that setting. Consider use, like I said, of the face shields when you can't even maintain 3 foot. If somebody's on an assembly line shoulder to shoulder with somebody, they should have the face covering and a face shield is what this says. But they don't have to. You could decide not to do that. You got to train your employees on how to wear, use, and maintain the face coverings. That is another resource that was on that OSHA page I showed you, our MIOSHA page at the bottom. There's a video on that. But basically, you know, it's positioning it over your nose and mouth, you know, what's disposable, what's reusable, that kind of stuff.
Anthony, I have a question. What if you're restaurant owners? A lot of the businesses we deal with, at least for us, are restaurant owners. So in their employees who might be working in the kitchen, and then somebody's in the front counter in the bakery and giving out to customers. So the employees that are in the back filling the order, do they need the face shield since there's no real social distancing happening, or the face mask is just fine?
This is where we're getting into a vertical standard. There's a additional requirement listed for restaurants in 161. And if you take a look, it specifies that regardless of distancing, if you're involved in food preparation, you must wear a face covering and gloves, I believe, at all times. So
Okay, thank you.
if they did maintain in food preparation the distance, they would still be required to wear a face mask at all times underneath the vertical requirements.
Okay.
So like I said, there's a lot of wrinkles. So I'm just going to cover the big one right now. I'm just going to jump into it. So in the workplace, this slide basically covers when you need to wear a mask, except it doesn't. Executive Order 153, which, and I might have that number wrong now, but what used to be 153, is addressing face masks worn by the public. An employee is a member of the public. Executive Order 153 says that when you're in any enclosed indoor space, you must, as a member of the public, wear a face mask. So, we need to divide all workplaces into two categories. Workplaces that are open to the public and workplaces that are not open to the public. If your workplace is not open to the public, right, you got a buzzer on the front door, you don't have a lobby, people can't just walk in, you're a secure work site, then your employees are not in the public anymore, and they can follow only what's on this slide. If you are a public workplace, think of a retail establishment, a grocery store, a theater, anywhere where customers walk in the front door without getting buzzed in, walk right up to the counter or walk around and do their business, right? Most places. Then guess what? You got to wear face masks at all times, regardless of distancing. And all these little things where you can sometimes take your face mask off if you're in your private office, you can't do that anymore because it's a public office. So if your workplace is open to the public, your employees basically need to be wearing face masks at all times, unless they're outdoors, I guess is the wrinkle that I'm trying to explain. I'm sure you have questions on that. We'll, try to hold them till we get through the rest of the presentation because it might get clearer, I guess is all I can say. This next slide addresses the difference between face coverings and respirators. As you can see, a surgical or cloth or paper face mask is not a respirator. A respirator is something that looks like what's on the third image there on the left. So what's different? Well, for starters, you see how the straps go around the top of the head and the back of the neck instead of around the ear? That's huge. For something to be a respirator, it's not going to hook around the ears, right? It's going to hook around the head and have two full straps that go around the head. If you are requiring your employees to wear respirators, you are in a whole new world of regulation. You need a massive amount of vendor support for fit testing, medical evaluation to wear the respirator, training to your employees, evaluation of the respirator for the contaminants in your industry, and that's what's all on the right here. So this is a trap. Employers might want to be very protective of their employees. They may want to say, hey guys, I don't think these cloth masks do anything to protect you guys. I'm gonna get you some good respirators. I'm gonna get you some N95s. You guys gotta wear these awesome N95s. I really had to hunt them down. I worked hard, I found them for you. Everybody who works here wears an N95 now. That employer just opened up a can of worms underneath our respiratory protection standard. A lot of liability. So what's the takeaway on this? If you're going to require employees to wear face coverings, it's actually better for the employer if they wear a surgical mask or a cloth face covering. It's not better for the employee's health, but it's better for the employer's liability. And that's just the catch-22 that these executive orders have put us in with MIOSHA. Those two links on the bottom expand on the information on the slide if you want some more in-depth coverage of this. But just the takeaway is you want to be pushing employers to put their employees in face masks, not into respirators. If they think that respirators are required, once again, I would have them contact me so I can talk to them about why they think that is. Okay, COVID-19 training for the employees. What am I going to train you on? What are you going to train the managers on? What are the managers going to train the employees on? What is in their program? These 4 major blocks. These are all in the COVID response plan. Workplace infection control practices, social distancing, hand washing, face masking. Proper use of personal protective equipment. That's how they're donning and doffing their face mask or putting their on and off of it. Notify them of COVID diagnosis. You know, who do they call to? You know what they do. That's on your plan. And how for safe working conditions. Under reports that they don't externally, something like MIOSHA.
Everyone heard him on that slide?
No, it broke up.
Yeah, you broke up, Anthony. Can you repeat that?
Yeah, what's up?
Yeah, sure thing. So this slide covers what an employer must provide in training to employees. So this is a checklist slide. Whatever training employees get, you want to make sure it covers these 4 topics. All 4 of these topics are covered in the COVID awareness and response plan template. So if you review that template with somebody, you're providing them with the training that's required. Did you guys hear that all right?
Yes,
Yes,
thank you.
Thank you.
Great. Additional infection control measures is necessary. This one is not very well spelled out. Here's what I think the governor intended. We were not sure which way this pandemic was going to go. It was possible that there was going to be a huge amount of cases in one area, such as Detroit, and not a huge amount of cases in another area, such as the Upper Peninsula. It was possible that the infection rate could reach such a level in Detroit that employers would want to increase protections for even medium risk or low risk employees because the community infection rate was so high. Basically, their chances of getting sick at work were going to be so much higher that they still, even though they were not high risk employees, we would want to give them things like full respirators or maybe additional Tyvek coveralls, you know, to keep, you know, stuff from getting on their bodies, or, you know, other policies like that. So I wouldn't worry too much about this one right now. Just kind of a catch-all, I think. Record keeping. Records must be kept on employee training, daily entry self-screening, and reporting of COVID-19 cases to the local health department, okay? Your records for your training are probably a copy of the training PowerPoint and a sign-in sheet for your employees. Your daily self-screening trainings are probably just a record that your employees have conducted the self-screening. So if you use, for example, that My Symptoms app, it would be the records in the database of that app from your employees that they have been doing these screenings, not the actual screenings themselves. And of course, you know, the documentation of referrals, that's probably going to be an email receipt or some kind of, you know, phone log documentation completed by the employee who does the referral. You're going to want to keep these records 3 years. It's my understanding it's a 3-year hold period on the executive order.
How do you verify if MIOSHA comes and do a little drive-by that I did train my employees?
They would ask for the training sign-in sheet and a copy of the training provided, exactly what I just recommended that you keep. They would then probably pull an employee aside and ask them if they had been trained. They might get a name or two of the employees who are present and see if their names appear on all the sign-in sheets you have. So even if an employee says no, he hasn't been trained, but you show them the sign-in sheet and you show them that they signed their name, that they have been trained, and here's the training, that would probably be enough to overcome the presumption.
Thanks.
And, you know, I guess I should add here, they would probably ask them about the content of the training too. You know, they quiz them a little. Nothing really hard, but, you know, maybe something like, you know, what risk category are you? So you've been trained, your employee trained you. Well, you know, what's your risk assessment for your job? And, you know, expect them to know whether they're low or medium or high risk, you know, something like that. Or, you know, I see you're wearing a face mask there. Are you required to wear that face mask? And, you know, they would have to know, yes, I am, or no, I'm choosing to wear it, or what the right answer was. So, all right. Once again, as of at least a week ago, the right order was 153 for the public. Executive Order 2020-153 requires any individual who leaves their home for any reason, including to go to work, wear a face covering when in any indoor public space. Once again, keep in mind that can be the workplace, or when outdoors and unable to maintain social distancing, think 6 foot, from those not in their household. And then, of course, waiting or riding on public transportation. So you got 2 masking requirements. You got the masking requirement of 161 and the masking requirement of 153, and the more stringent one controls. Everyone is required to wear a face mask as described above, except what's listed on this slide. So there are a few people who, when they're out in public, you know, or in an indoor, mask. And, you know, of course, these are the ones we get all the questions on: medical toleration, I don't know, public speaking, you know, when giving a speech, what's a speech for an audience, you know, that kind of stuff. So I know that there's probably some of you have questions on this stuff as well, but once again, if we could hold them for the question and answer period, that might be best. 153 says that if your business is open to the public, you must post signs at the entrances, whichever way a person can get into the workplace, informing them of the requirement to wear a mask. This gets really tricky. I have a sign on my door that says, "You must wear a mask to come in to my business." A customer, a member of the public, comes up and, without wearing a mask, says, "I want to come into your business." The business owner is entitled to say, "No, you may not," unless they assert one of these defenses. The most common one is the second one: I'm not able to medically tolerate wearing a mask. The business must then make a choice, okay? They can make a reason. The most common reasonable accommodation is a face shield. Have a little stack of face shields available. The reason people can't wear a mask is they can't breathe through it, is the claim. Personally, I think that's BS. But the claim is, I can't breathe if I wear this mask. Excuse me just one moment.
I love Zoom calls.
Sorry about that, you guys. Working from the home office. Let me see, where was I? Okay. They say I'm not medically able to wear a mask. It's up to the business to decide what they're going to do at that point. They can say, I am choosing not to serve you. That brings them into issues with the ADA, right? If that person is actually in a protected class and they refuse service, because of their health condition, that can get a business in trouble. So what I would recommend is they have a reasonable accommodation. The most common one, like I was saying, is you can't wear a face mask. I assume that's because you have COPD or some lung condition, or, you know, you're not healthy enough to wear a mask. Here's a face shield. These don't impede your breathing at all. Wear this while you're inside. I would point them to that first. If that doesn't work, I would see if someone could shop for them. What are you looking for today? We'll get it for you. You stay outside. We'll get you what you want. What do you want? You know, tell my shopper. This is my employee. She'll go get what you need for you. What they're likely to do, because it's easiest, is say, okay, come on in. You know, they can take them at face value if they want to. Yes, that will prevent the customer from going to another business. That will help them make money. That will help them move product. But if that person is sick, and if one of their employees gets sick, that's a workers' comp claim waiting to happen. So you can see how it's kind of a rock and a hard place for business owners. So, you know, my personal advice is probably what I just said. You know, okay, you can't wear a mask. I don't want to let you in my business without a mask. I'm going to accommodate you. We're going to shop for you, or we're going to give you this face mask, or we're going to give you this thing that's still going to protect people. So that's how I would handle that situation that's likely to arise. All right. Everybody needs to be washing their hands way more than they used to. You should put up hand washing signs for your employees. You want to use soap and water as your primary. However, where soap and water are not available, your second best option is an approved hand sanitizer, such as at least 60% alcohol hand sanitizer. I've seen studies saying that 30% is effective, by the way, but on the OSHA guidance, it says 60. So for your safety, you know, 60 is a safer number than 30. Everything that's on here, just run through this workplace practices with your employees as part of their training. You know, don't touch your face, nose, mouth, stay home is sick, all that stuff. And then all this information, if you want more, is at that bottom OSHA control and prevention hyperlink, so you can get more information for your trainings. Okay, everything up till now, every business must follow all this stuff. If they have an employee who leaves home for work, they must do everything we just talked about. So regardless of what industry section you serve, they got to do everything I just talked about. That's every business in the state of Michigan, whose employee leaves home to do work. That's almost everybody. Then, just to give you an example, some industries have additional requirements. So these are the additional requirements, just to give you one of them, for retail stores. Think a low boutique t-shirt print shop, you know, over in the financial district or something. You know, we got people who come in and grab t-shirts, and we got a couple people who sell shirts. If for any reason they need to identify themselves, that's an acceptable reason to take the face mask off. They do need additional signs. So not just the no mask, no service signs, they need to have additional signs informing them of the changes of store practices. You know, we have put in one-way markings, please follow them. You know, for the safety of other customers, we are limiting people in the store to 5 at a time. If there are more than 5 people, please wait outside, or whatever it is. There are different requirements based upon the square footage of customer floor space. If you have a large area, you must limit occupancy to a specified number of people per square footage. If you have a small area, it's going to be a percentage of the local fire department amounts. Also, if you're a large store, you need to have designated vulnerable population shopping hours. So if you're a big store over 50,000 square feet, you need to have designated vulnerable person shopping time. If you're small, you don't have to do that, but it would be nice if you did, you know? So not required though. So everyone has to have the face mask sign, but if you're in retail, you have to make sure you also have a sign telling them not to come in if they are or recently have been sick, right? So that's an additional requirement. Additional training, as you'll see, you need to know how to handle symptomatic customers. So straight up, if someone walks in to your Trader Joe's and they are coughing up a storm, what do you expect the cashier to do about that? What, is get a manager, ask the person to step outside while you get a manager, remove the person from the store immediately, quarantine the area they were coughing in and disinfect it? I mean, what do you want to do? So that's the kind of training that the employees need, as well as how to clean their personal work area. The notification is the same as everybody. So keep in mind, a lot of businesses that are private will never have an individual who's not a customer, who's not an employee come in. They're closed business sites. Retail, most people are customers or suppliers. Most people are customers. So the employer has an obligation to inform employees if they learn that a customer or supplier had COVID. So they don't need to go beating down doors to get the information, but if they are notified, they must pass that information along to the employees. Maybe this bears a little bit of expounding, but I think this is all employees. I don't think it's employees who are there and the individual is there. I think it's all employees. I don't think that's restricted to anything. All right. Retail places are required to install physical barriers. We had the question from Gracie earlier, can we do any of these? And the answer generally is yes, any of them, your choice of any one of them. But for retail establishments, they must have physical barriers at checkout or, customer service counters or anything that requires interaction. So a mere sign is not enough if you're in the retail world. Also, in retail, you'll see that they have a requirement for cleaning of shopping carts, right? Which you wouldn't see in other settings. So, the vertical standard kind of look at that specific area. I'm not going to read these slides. I think they're pretty self-explanatory. But as you can see, retail establishments have a lot more. OSHA has fact sheets. MIOSHA has fact sheets. Rules are continually changing. Each of the PowerPoints ends with a series of resources. These are a lot of the same resources that are on our web page. I would direct you to the web page. But these are typically more industry specific. All of the presentations are contact information. Like I said, they can use any of these resources to get further information. One thing that I think is important is they call that safe C19 number. That's not a complaint line. That's just a question line. That's answered by guys like me. Like I don't want issues. I give people good information and I want them to feel comfortable calling me. So don't worry, that's going to get you in trouble. It will never get you in trouble. And that's a typical PowerPoint. So that's kind of what you would run through with your constituents. The next thing that I'm going to jump into is the template. Before I do that, does anyone have a question that they think should be addressed now before we look at the template plan? Okay, I'll jump into it then. If you guys want to get your plans out, if you have any of them that you've worked up or that your constituents have worked up and sent you that they have questions on, that would be a great time to do it so I can answer any questions as we're going through it. All right. So can everyone see this Word document all right?
Yep.
All right, great. So this is the written safety.
Anthony, is there any way, I'm sorry, I'm on a phone, so my name is real tiny. Is there any way you can zoom in a little bit?
I think so.
Okay, thank you.
Yeah, I think that works. How's that look for you?
Yeah,
all right, great.
Thank you.
So this is a Word document that was prepared by MIOSHA staff, including yours truly. The MIOSHA enforcement staff will be expecting any business that's operating to have one of these plans readily available upon request. Doesn't have to be this template, but I would highly recommend that they use templates that they know that the information that they want is in there. Strongly recommend. So it's fill in the blank. You'll see that they can do a Control F for company name and just fill in those blanks. Or they can just go through it line by line. So I'm just going to talk through kind of how you would typically complete one of these. So company name would be general there. Executive orders are linked here. Requirements are. So this preparedness and response plan covers the general industry requirements of 161 1A to U, right? This checks those boxes. If you're in a vertical industry that has additional requirements, such as the retail one we just looked at, you're going to want to make sure that those additional items are put explicitly typed into this program. And I'll show you where those go in a minute. So right up top, company name, once again, an exposure determination, put in the appropriate name. One person will be responsible for seeing that the exposure determination is performed. That's typically either the designated safety and health person or the highest ranking operations person. So typically the safety manager in a large company, or a manager or vice president, depending on the size of the company, in a small company. It should be somebody with knowledge and authority to act, right? Somebody who's able to make people do stuff. It shouldn't be a cashier. As we said, we start out with a risk assessment. You have kind of the textbook definition of what these risk jobs are. So not just my off-the-cuff definition. Do not require contact with people known or suspected being infected with SARS, and nor frequent close contact with the general public, okay? So think of the work from home person or the person who works entirely in an isolated office. You know, most people won't be low exposure. Most people will be medium. Medium exposure are those that require frequent or close contact, COVID, or excuse me, frequent or close contact with those who are not known or suspect COVID-19 patients. Basically, that's people. Because of how symptoms work with COVID, medium exposure risk jobs are those that require frequent contact with people. If you don't have a lot in the community, it's people who have a lot of contact with travelers. Unfortunately, based upon kind of where we are with infection rates right now, general is enough. So pretty much people who interact with the public are medium exposure risk. Once again, this is the low and medium exposure risk template. So see, we don't address exposure risk. If we did, it would say that they have frequent or close contact, known or suspect COVID needs. So it's typically medical services and the things I described earlier. This is where the person does work in the template, this table right here. So this is a table format. They don't need to use it. Then cut the table and start typing paragraphs if they feel better about that. But the idea is you put a job category in the first column, right? Then you put their determination, you know, what is their risk category, in the second column. And then you put the qualifying factors in the third column. Right? Something like that. And then you're done. And then all you got to do is really work down what are the job positions that we have. Okay, I have a laborer, I have a welder, I have a mason, I have a job superintendent, I have a custodian, you know, and for each of them, most of them are going to be medium, and most of them are going to have similar job qualifying factors. So you just complete this table, make sure that it covers all your employees. Whatever employee is going to be on your job site, make sure that the position / job / task, you got something that covers all of them. So if you had a typical grocery store, it's great if you have something for the cashiers and something for the stock guys and something for the manager. But you gotta make sure you have something for custodian or something for the, I don't know, deli.
Security guard.
Exactly. So, you know, look for those. And like I said before, something that's going to get a lot of companies is their first aid responders. Keep an eye out for first aid responders, and going to have to put something in your qualifying factors if you're going to be calling them medium. You know, they have been instructed, you know, not to approach, you know, whatever it is you're going to be doing. Because otherwise, it could be foreseeable that going to respond to COVID symptomatic person as part of their first aid response duties. So keep an eye out for that. Engineering controls. Engineering controls are those plexiglass barriers, signs, directional arrows, control the occupancy of the building, those types of things. So this is where you list out what they're doing, physical changes they've made to their workplace, right? We shifted, you know, put X's on the chairs, we removed some of the stations, you know, we installed sneeze guards, we shut down this operation, we're doing things, you know, now they text us and we come out to their car when they're ready, or whatever it is. This is where most the controls that the company is doing the place. The physical changes to operations. When you see engineering controls, think physical changes to the property. Those changes go down here. So once again, we might have something like a cashier, engineering control, installed plexiglass barriers, enhance cleaning of register, installed for markings, you know, all this kind of stuff, right? Those are the engineering control changes, right? The physical changes that you guys made. Actually, in cleaning is probably not engineering control. I actually caught myself on that. That's not a physical change in the premises. It's all plexiglass barrier, floor markings, do not handle credit cards, you know, that would be one, I don't know. You know, install the credit card machine instead of swiping it yourself. That's an engineering control kind of thing. So just put in what you did. Plain language. Doesn't be in any particular language, but same thing. Make sure that for each of the positions that you have, to the best of your ability, you describe the engineering controls that they have. You don't need an engineering control for every job, but if you don't have one for a job, you better be ready to explain why you could do something. You know, oh, we couldn't install a barrier because we need to do whatever.
I just want to do a time check, Anthony. We have 15 minutes left.
Oh no. Okay, I'm going to move real fast so we have time for questions and answers. And I'm going to skip the part about the enforcement then. Administrative controls, think employee training and standard operating procedures, changing how they do their job. So an administrative control for every employee that you can put in this table is training. We train them on new interactions with the customers. Encourage remote work. We put signs up, whatever it is. And each of these sections has an example above it. If you have questions about what falls in each of these, you can Google engineering control, Google administrative control. OSHA will explain what these terms mean. There's a section on hand hygiene and disinfection. Once again, from the blank. You don't need to put a specific manufacturer product in here. You can put approved for high contact surfaces, but try to describe what your enhanced cleaning procedure is here. The most common thing is going to be we're now using an EPA approved disinfectant instead of, Clorox spray, whatever. We're now using an approved, effective COVID virucidal thing. And letting it sit. Spray, we let it sit 5 minutes before we wipe it. Look at the CDC documentation, you'll see what they're looking for. Personal protective equipment is gloves, face coverings, things like that. So you just put in here what each of your jobs are receiving in the way of PPE. Typically, for most jobs, it'll probably be we gave them a non-medical grade face covering. They got a box of 20 disposable surgical masks, or got 2 cloth masks, or whatever it is. That'll be enough. Maybe you'll give them a box of gloves. Maybe give them some hand sanitizer, but doesn't have to be a whole lot. Health surveillance, that was the My Symptoms app I described. You could also do a hard copy electronic health screen where you ask them, are you experiencing the symptoms? They would then complete that questionnaire and just inform you that they completed the questionnaire and they're okay to work. You would not receive the information, the symptoms that they have. I know short on time, but I can't go into that. If you have questions on HIPAA, AD, health service errors, reach out to me separately. I'll be happy to talk to you. It details how employees are to report, how they're going to be isolated, how long they're going to quarantine for, what to do if someone in their family gets sick. Once again, the training section, this will probably be whoever you guys train, the manager. This is their checklist for their training. Every CDC training has this. COVID is transmitted by air, person to person, can remain on surfaces for a period of time. Symptoms are, tightness in the chest pain, sneeze, and coughing. We have a training module available for employees in that resource. I think I pointed out to you guys on the start. Record keeping, we talked about required training, self-training, and positive confirmed cases. Just keep those in your HR office or in your file cabinet with all your other employee records. And then the last page can be deleted by people. It's just our plug. It's kind of, hey, if you're having problems, you can call, and here's a phone number you can call us at. All right, so that's the end of the program, the written program. We're down to only a few minutes for questions, so I'm going to not go over the enforcement special state emphasis program. I'm just going to give you the highest of highlights on it. That is, enforcement officers are expected to inspect a lot of facilities this month for COVID compliance, meaning they are out beating the streets. They are, just like police officers are told they have quotas, our enforcement people got directed to do a certain number of these inspections before the month is over by their bosses. They're going to be inspecting on this stuff more than ever. Okay, So that was all I have. I'm sorry I didn't leave more time for questions. Please, if anyone has a question, let's open it up.